lighting your way.
The dramatic increase of mental health prevalence in Washington has raised the need for specialized, higher levels of care.
Recently in Seattle, especially with COVID, we've seen definitely an increase in need, increase in acuity of mental health needs.
There's just not a lot of resources around here for residential level of care. There's virtually no support for adults that are in need of the higher levels of care, as well as very few options for adolescents.
What residential in Seattle means for adults seeking a higher level of care.
Residential level of care is a new level of care to the Seattle area. When we've had patients that have needed residential level of care, they've been unable to access it for a various number of reasons.
I think the way that residential kind of fits within our community in Seattle and just in general is it provides that space that is needing kind of more intensive care. This is one of the things that I think has been a challenge without a lot of residential access, is then there's patients that are kind of in partial hospitalization level and there's nowhere to go, and then they end up being hospitalized because there's no middle ground.
You get overflow of mental health patients in medical floors and the emergency rooms. Residential and partial settings really provide another space to prevent the acuity from getting that high.
What residential in Seattle means for children and adolescents seeking a higher level of care.
Residential for kids is especially hard to find. There's probably one or so in the state, maybe a couple. I know that it's been really hard to find referrals for residential treatment for kids and adults, but kids especially. So I'm really glad that we're going to be able to meet both those demographics.
I'm really excited about Pathlight in Seattle. We are the only residential service that is actually serving the child and adolescent population in the Seattle community. That is huge. Instead of having to, say, transfer my patient to even an acute inpatient center, we're able to use a comprehensive resource or a residential facility that is already here, already located in the state.
We know treatment is not always linear. We provide a continuity of care.
Additionally, there is that continuity of care. I will remain the attending physician for the child once we step them up in terms of providing that 24-hour support.
In Pathlight, we have 3 levels of care: residential, partial hospitalization, and intensive outpatient. It really provides kind of appropriate settings for different needs. The kind of other benefit of having those 3 levels of care all kind of within the same location is not only for stepping down, but also if there's a need where someone needs to step back up. So it's kind of seamless in that way. Because treatment isn't always linear.
What does it mean to take a trans-diagnostic care approach?
At Pathlight, we really try to teach that there is a whole person, whole brain approach. Part of my work is to tell people all these untapped treatments with behavioral activation, cognitive behavioral therapy, acceptance commitment therapy, dialectical behavioral therapy, radically open DBT as well as principles of safety are really core to people's recovery.
With that transdiagnostic model, we're more focused on kind of the common themes that show up across diagnoses rather than solely focusing on a diagnosis to determine what to do. So we're really looking at those underlying themes as a way of providing treatment to a variety of patients at the same time that might have different diagnoses, and it's still effective because that approach to treatment is what can actually be more helpful in addressing what's leading to kind of the mental health kind of suffering and pain.
What is the transdiagnostic approach when it comes to treating children and adolescents?
Our transdiagnostic care allows for basically multiple eyes on the patient. This essentially means that the patient and their family is comprehensively assessed, comprehensively diagnosed and treated. If we think about child and adolescent psychiatry is truly family psychiatry. So this allows us, by having individual therapy or individual therapists get a perspective, meet with the patient and their family, the child psychiatrist meet with the patient and their family, and also, having the ability to have access to family medicine or pediatrics, meet with a child and family. We get basically a whole person approach or a whole family approach in terms of diagnostics and also treatment.
The residential space and location.
We're really excited about this space. A lot of thought went into every detail here. Having natural light, having easy access to staff at any given time, and the ability to not feel crowded. We don't want it to feel like a hospital. We want it to feel like a place that they can heal.
With the space and how beautiful it is, it can create that environment that's more welcoming, warm, and allowing patients to challenge themselves to share things that would be difficult.
Connecting the residential space with the Seattle community.
As a way of kind of connecting with our own community and our surroundings, we definitely were mindful of that. So we're naming our group rooms off of neighborhoods in Seattle, as well as a lot of the portraits and paintings around mountains and nature that's from the Seattle and Washington area. So we're excited to kind of also represent the area in which we exist and to connect that way.